Good afternoon. Thank you for joining us for our fifth day of the SRNA virtual conference. I would like to open today's session by acknowledging the members, partners, and members of the public that are joining us today on Treaty 2, 4, 5, 6, 8, and 10 territories and homeland of the Métis. I acknowledge the strength, resilience, and capacity of all First Nations people and remind us that we are all treaty people. My name is Frankie Verville. I'm a nurse practitioner and I'm your council president-elect. I am pleased to be joined today by Fred Enns, council member at large for Region 1, to welcome you to this session and provide some valuable information as we move ahead. Before we start, we'd like to thank our presenting sponsors, Miller Thompson and the University of Saskatchewan College of Nursing, for their ongoing support. Their financial contribution made it possible to bring this virtual conference to our members, the public, and our partners completely free of charge, and we thank them very much for this.
Good afternoon, Frankie and everyone else on the call. Thank you so much for joining us today. Yesterday, we learned about the Association Pillar for Registered Nursing. In the second part of this three-part session, Mary Smith, RN, and Executive Director of the Association of Regulated Nurses of Manitoba, shared with us how the professional association acts on the behalf of nursing to advance the profession and influence health and social policy. If you didn't have a chance to tune in live, which was session excellent, by the way, the session was recorded and it's available for playback for 30 days following the conference right here on this platform. Today, we will dive deeper into the three pillars of registered nursing. In this third and final session of this three-part series, we are pleased to welcome Deanna Williams, registered pharmacist of the Dundee Consulting Group, who will share with us the role of the regulator and her experience working with health regulators across Canada and around the world. Deanna is licensed as a pharmacist in Ontario and has held several positions within the Ontario government's Ministry of Health and Long-Term Care before joining the Ontario College of Pharmacists in 1994. She retired as its registrar in 2011, and since then, through Dundee Consulting Group, Deanna has provided consulting services in areas relating to professional and occupational regulation in Canada, the US, and abroad.
Thank you, Fred. Following Deanna's presentation today, both Tracy Zambory, RN, and the president of the Saskatchewan Union of Nurses, who spoke on the role of the union on Wednesday, and Mary Smith, RN, the executive director of the Association of Regulated Nurses of Manitoba, who spoke yesterday about the association pillar, will join us for a live Q&A session. They will address the questions our viewers have submitted throughout the week on the roles of the three pillars. We encourage you to participate today by asking your questions for the panelists. You can take part in this Q&A by switching to the Engage tab in the session. Toggling to this tab will take you to a screen that allows you to input any comments or questions you have for our speakers. Tracy, Mary, and Deanna will have the chance to respond to these questions following today's presentation.
Thank you so much again for joining us this afternoon. The regulator plays an important role in the registered nursing profession, and we're so proud to introduce Deanna Williams now to share the work of the regulator and its role within the three pillars of nursing.
Well, thank you very much. I'm thrilled to be part of the session today. So we're going to talk a little bit about regulation in the public interest. In the regulatory world, you know, the models of regulation vary, but one of the things that's consistent and common across jurisdictions and across professions is that our mandate to serve and protect the public interest does not vary. So this is a very key point to looking at regulation in the public interest. If you look at where we have our roots as regulators, we really do have our roots in the guild system in 14th century England. And you may remember that the guilds were originally both regulatory as well as advocacy. And everything has evolved to a point where things are changing around the world. And we're going to look at some of these trends in a little while. But these are all being changed because of certain reactions to things that have been happening worldwide, and we'll talk a little bit about that. Competing interests are one of the challenges of all regulators. And it's really a significant challenge to try and achieve the balance between our obligation as regulators to put public interest first and balance that with the need, if you will, to also regulate our profession and provide guidance to the profession to be the best that they can be. So balancing those competing interests is a real challenge for regulators. And again, it's a common challenge across jurisdictions. A really key and important point to remember as regulators that is the why we exist. And Simon Sinek, who is a academic who talks about this golden circle, says if it isn't clear why we exist, then what we do and how we do it really doesn't matter. And I think this is of key importance to us as regulators, that everyone has to be absolutely clear why, as regulators, we exist. Now, regulatory privilege, I just would like to mention this because I think that it's important to know a couple of things. One is that self-regulation as we enjoy it in Canada is very unique. And it's unique in three regards. One is that in Canada, we have the complete autonomy with respect to how we set, use, and collect our fees. We have the ability to discipline our own, and we still retain the ability as professions to elect peers in practice onto regulatory councils. And these are three sort of pillars, if you will, of self-regulation that are quite important because we only have these in Canada. But the privilege to self-regulate is something that we can't take for granted. It's a privilege that has been lost in some jurisdictions, most recently teachers in the UK and in British Columbia, denturists in Ontario. There's a huge list of professions around the globe who have lost their ability to regulate themselves. So it's important to understand that what we have is indeed a privilege, and it's one that we would want to keep. Some of the things that challenge us today as regulators are here. Certainly we're under increased scrutiny and attention, and there are a lot of calls on governments to impose things on regulators that will ensure greater accountability and, of course, transparency. Recent media attention has certainly put regulators on the radar screen. And I think profiling of other regulators, profiling of some very important cases and how they've been dealt with by regulators has put us all into the public eye. And so there is an increased attention as to what we do and more importantly, how we do it. Some of the other challenges are listed here. Certainly self-regulation has a cost to it, and there is a critical mass that we all require. We have to have a certain number of registrants in order to be able to support the regulatory body in doing all the things that it needs to do in order to be an effective and credible regulator. And I think that the last point is a really important piece, and that is that there is an increasing sense, if you talk to people around the world, that public confidence and trust in regulation is being lost. And I think that that's, for us as regulators, such an important piece is to maintain the trust and confidence of the public, whom we're here to protect. Now, the attention on sexual abuse that we've seen with the Me Too movement has certainly presented other challenges. And I think the most important piece is the last point here, is that we have to sort of think about when we make decisions, when we take actions, particularly that are related to sexual abuse and cases that are associated with it, we need to keep in mind the changed expectations of the public. Societal views have changed, tolerance levels have changed, so we need to be brave as regulators in doing the right thing, even if it's not necessarily what everyone wants us to do. Globally, clear and distinct separation of the advocacy and regulatory functions is best practice. And I think that what SRNA is doing, the increased regulatory focus that SRNA is moving towards is certainly in alignment with international best practices. So we're going to look at some of these trends because in jurisdictions, and here they are, UK, Ireland, Australia, and certainly across Canada, governments are imposing certain things that are assuring better oversight and accountability of regulators. So we're going to look into this in a few minutes in a little greater detail. So let's look first at public interest and what it means, because regulating in the public interest, in my view, really is a social contract. So we're going to look at what it means to the regulator, what does it mean to our professions, to the registrants that we regulate, to government, and then of course to the public. When you look at what it means to us as regulators, we really have statutory functions that we perform that are actually set out in statute, so they're set out in law, but these are things that are listed here on the screen. And I think that by fulfilling these statutory functions, we ensure public safety and protection. And the last piece is important because we not only hold our registrants accountable, but we also have accountabilities, and we're going to talk a little bit about that in a few minutes. Public interest and the profession, you know, the public interest and the profession interest is not, in my experience, all that different. Really, in many cases, in most instances, what benefits the public and often benefits the profession as well. So I think it's trying to find those sweet points, if you will, or the areas where public interest and professional interest truly do intersect. And there's many examples of that, and we're going to look at those in a few minutes. But I think to try and identify the areas where there is commonality between what's in the public interest and how does that also translate into professional interest is really an important part of what we do as regulators. Now, with respect to professional advocacy, again, we have to keep in mind that what benefits the public often benefits the profession, and we have to strive for consensus and agreement on those things. So you want to find out where the commonalities are and try and strive for some kind of consensus about how we're going to approach certain things, keeping in mind that regulators may have to take a slightly different approach because our public protection mandate is clear. The professional advocacy groups can take another approach, but we do want to try and achieve consensus and work together on things where we can. Now, the last point is really important, and that is that agreement on things is okay, but if we find as regulators that we're agreeing with the Professional Advocacy Association on everything, then that's probably not okay, and that's usually a fairly good benchmark. The government really generally lets us do our own thing as regulators. We're set out in statute, they set out expectations, we file an annual report with government, but there are increasing pressures, as I mentioned before, to impose mechanisms that ensure greater oversight and accountability. The regulatory framework that establishes us as regulators is very clear and it's defined. And so we have to work very hard as a regulator to build and maintain public confidence and stakeholder confidence and trust in what we do. And we do that by evaluating and being accountable for the decisions we make and the actions we take, and most importantly, being able to demonstrate that they are in fact aligned with our regulatory mandate to put public interest first. Now, there is some confusion, even in our electoral models that we have in Canada, we elect our professional peers to sit on our regulatory councils. And as soon as they get on the councils, then they learn that they're not here to represent the views or the wishes of the people who elected them onto council. They are in fact there to put public interest above all others. And it's a bit of a confusing and a hard reality. So I think that we have to understand that public interest is a very subjective concept, and we just have to make sure that we're always asking that question, is this in the public interest, and how can we be sure? Some of the other places where I think it's confusing for the public when we say public interest is our first concern is that most of us operate in Canada at any rate where our councils and committees have professional majorities. And it's not often clear to the public how our decisions benefit them. So we haven't done a very good job as regulators in trying to explain when we make a decision why this is in the public interest and how we believe that this is the best one to serve the public. So we need to be better about that. If our actions or decisions were to end up in the public domain, would we be all right with it? And this is a really important question that we have to ask. And it's an important question that the members of the profession should be asking too, because we want to be all part of a profession that's seen as being credible and effective in regulating ourselves. And so this is a very important piece. Would others see that our decisions and actions are things that would be protecting and serving the public interest? And I think that these questions, we have to keep coming back to them. It's probably easier to define what isn't public interest. One of the things that I think poses the greatest risk to regulators is the last point, and that is where we might cloak or an action or an ask that we want to do as a profession as a public interest argument, when in fact it's really a professional interest argument and others would see it that way. So we have to be very careful, because going forward with something in the name of public interest when it really is more professional interest and professional interest only can really pose a reputational and regulatory risk to us as regulators. Some issues to avoid are reimbursement, funding, employment issues, issues that have to do with competition. One one example would be keeping out, trying to do things that might keep out certain members from a profession. And conflicts of role and interest, we have to be very, very careful that we manage those. And these are some of the issues that would belong better with a advocacy association and not with the regulator. Now, public and professional interest can and do intersect. I had mentioned this earlier, and I said I'd give some examples, and here they are. Continuing competency, continuous professional development, all of these enhanced practice to increase access to services by the public, embracing principles of fairness, objectivity, and accountability, and timeliness and transparency of the decisions that we make and the information we provide. All of these are equally in the profession and the public's benefit. So I think that we have to search for some of these and then focus on those as regulators. Across professions and jurisdictions, all of us are challenged by similar things, and governments are making changes in response to these. So let's look at some of these. Because what happens in one jurisdiction can happen in other jurisdictions, and these are things that our government is looking at. So for example, in the UK, in Australia, New Zealand, and in the US, there are no elections of professional members onto regulatory councils. Everyone is appointed. So whether you're a public member, whether you're professional members, all council and committee members are appointed pursuant to some sort of defined and accountable recruitment and screening process. There is a move away in most jurisdictions from professional majorities. So in Ireland, is the only jurisdiction that right now currently has a majority of public members on their regulatory council. So 51% public members versus 49% professional members. The UK and British Columbia are two jurisdictions now where they're seeing 50% of each. There's a trend to smaller board sizes. I know in pharmacy we used to have 35 on our council, which was way too many. Smaller board sizes, best practices around 12. Multi-professional regulation, that's where you have a whole group of different professions that are regulated together under one regulator, and we're seeing these in the UK, in Ireland, in the US, and also in BC. Where the dentists now, they have 5 different oral health practitioners that are being proposed to go under one dental health college, and we also are going to be seeing, if the proposals go forward, a multi-professional regulator there as well. The other is that statutory committees and processes, so discipline and complaints, best practice internationally is that those happen independent of the regulatory council. So if you sit on the regulatory council, you don't sit on those committees, just to make sure that there is no potential for any conflicts. So if you look at British Columbia, there have been significant proposals for regulatory reform that have been released. 21 regulators are to be reduced to 5. They're going to have boards instead of councils of 12, which everyone will be appointed, and that would be 50% of public and 50% professional members. The basis of appointments will be competencies and skills. An independent authority will adjudicate performance reviews and also discipline hearings on behalf of the regulators. And again, if you sit on the councils of the colleges or the boards, you will not sit on the statutory committees, so you wouldn't be on discipline or complaints. In Alberta, there are some new proposals for regulatory reform that have been developed. Some mirror those in British Columbia, but not all. And so you have to kind of keep your eye on some of these things that are happening. In Ontario, the government has developed in collaboration with the regulators a performance management framework, which when it's implemented will guide regulators in assessing and reporting on their overall performance against certain benchmarks. And those reports will be made public. So some of the other best practices, just to keep your eye on some of the trends, is that there's a cooling off period. If someone has been on an association board or involved with an advocacy group, they have to have a cooling off period of a couple of years before they come onto the regulatory group. And again, some of these other things, we've talked about the council sizes, clear declaration that statutory panels have dealt with conflicts, and a clear rationale so that in decisions the public is aware of why this decision was made and how the panels that made them feel that they are in the best decision of the best interests of the public. So in summary, it's very important to keep abreast of regulatory trends in other professions and jurisdictions. And I think the second point is very important too. If change is coming, where you want to be is at the front of the train. You want to have some control over what's going to happen. You want to help shape the change. And I think it's fair to say, looking at what's happening in other provinces, the change probably is coming. So we want to start asking those questions is, what should our change look like? What would we want to see? And what are the small things we can do now to try and change those? And then asking the hard questions. You know, the regulatory councils really rely on and need the profession's support in them asking these hard questions. So when something does come before a council, and it can be very difficult sometimes, because sometimes what's in the best interest of the public isn't always something that is so palatable to professional members, but councils really do need the support of the profession in asking those hard questions. Is this decision or action really in the public interest? How do we know? What changes could we consider to demonstrate that we're committed to putting the public first, and that we're accountable for that? And these are things I think that are very, very important going forward. So that's what I had to share with you today, and I hope that we'll have some good questions and discussion going forward. Thank you very much.
Thank you. Deanna, that presentation was tremendous, and thank you very much for speaking with us today. Some of the things that I just felt were really key points that you brought up were ensuring that we have clarity of purpose as we move forward, and truly defining what that is, what we mean by public interest, and being able to provide all our stakeholders and the public clear information as to why decisions are made and how they meet that mandate to protect the public. Some of the other comments that you brought forth were that profession-led regulation is a privilege, and that we have to be cognizant and very appreciative of the fact that it is a privilege, not a right, and that we have to do things and be very transparent in the things that we do in order to ensure that we uphold that mandate of service to the public and protection of the public. So thank you very much. So we will now begin our 30-minute Q&A portion of this session. And we've asked our previous 3 speakers to join us to answer questions received from attendees over the last 3 days and further provide some insight on their relative perspectives. So I'd like to start with you, Mary, today, as we did receive some questions following your presentation yesterday. So one of the questions we received was, does a focus on shopping discounts detract from the professionalism of nursing? As a female-dominated profession, we are often not taken seriously, and I worry this is not the best way to get people to join, with a focus on money as opposed to professionalism.
That's a great question, and thank you for submitting that. What I'd like to do is go back to the presentation, and the focus slide does not include anything about the shopping discounts. It's actually considered more like one of the benefits of membership. So I just think the wording, I just want to reiterate that the focus we have on that slide was professional voice, advocacy, professional development, and nursing excellence. So when we're talking with stakeholders and members and things like that, that's our focus. And then we will get challenged. When we get challenged on the price, that's when we bring up the opportunity or the benefit of these ways that the member could recoup those fees. So it's really, we're very transparent about our fees, that it's voluntary, and this is a way that they can recoup. And honestly, when you have over 10,000 members, there, as I'd mentioned before, there could be 10,000 reasons somebody's going to join, and we're trying to hit as many interests in that ways. And we do have members tell us that, I really like the benefit of being able to access, because it's not just shopping discounts, it's insurance, financial advice, things that some professionals are looking for as well. It's very broad. And but then they know that our focus, what we focus on, is the professional development and the advocacy. So I hope that explains that.
Thank you, Mary. The next question is for Tracy. And you've held an integral role with the Saskatchewan Union of Nurses for a number of years. Can you elaborate on the importance of having 3 distinct and separate pillars of nursing, and more specifically comment on how this move may better support your work from the union perspective?
Thanks for that question. It is, the 3 pillars of nursing have always been very important. I think the nursing profession benefits from having all 3. It is advocacy for us is extremely important as registered nurses and as SUN. And if we go back and think about my presentation, I talked about how all of those things can work in tandem with one another, must work in tandem for one another, with one another. And it really is, where we benefit from being regulated. It keeps us a very professional organization. We support regulation. It is essential that the public be kept safe, and that those rules apply, and that there is that type of oversight. It also is extremely important that we as a union are able to be the voice for registered nurses. That part is extremely important as well, that there is, we are that strong voice, that the profession itself is supported. We advocate for the workers in the workplace as registered nurses. But as in 2010, we decided that we as a union and as a membership of 10,000, that we needed to look at professional practice, because it is important to us as well as a union that we have sound nursing practice. And we knew that we needed to be able to come together and work on that. So we think that this is how all three of the pillars, each alone are extremely important, but together complement one another.
Thank you very much, Tracy. So the next question is for Deanna, and the SRNA recognizes that the move from dual mandate to the single mandate of regulation will come with its own set of challenges. From your perspective and experience, what are the greatest opportunities for registered nursing in terms of governance and regulation by separating the three pillars of nursing?
Oh, well, that's a great question. You know, there are challenges, and I think one of the opportunities that exists in the nursing profession, to be honest, is the critical mass is so large compared to some of the other professions. And where I've seen the greatest struggle, where regulators have tried to sort of split away from an association, is in the professions that don't have a large critical mass, and they worry about how they're going to fund either themselves as a regulator and or a corollary association. So I think one opportunity that exists is that you have that strength in all three pillars right now going forward. So I think that that's a very positive thing. I think the second thing, though, is that you're taking steps to be ahead of the curve. And if you look at what's happening kind of in the global trend, and then what's happening in Canada, is that the governments, if regulatory and advocacy groups are not taking steps to sort of make that clear distinction themselves, then these things are being imposed. And I think it's always best to be at the front end of the curve, which is something that I said in my presentation. And I think that you are showing tremendous leadership by doing that. You know, are there going to be challenges? Yes. And there are challenges, I think, even in some of the professions that have never been dual object or had the two different sort of objectives within the one mandate. But I think that the biggest opportunity is that you have such strong pillars already that are there to support the profession in making this move. And I think that's a very positive thing.
Thank you, Deanna. Mary, I'll move back to you now. And another question we received was, in the US, statistics suggest that about 1/3 of registered nurses join associations. To date, what is the number of registered nurses that have joined the association in Manitoba?
Thank you for that question. We are very, very fortunate that we have close to about 83% of all registered nurses. The number that we're currently representing licensed practical nurses and registered psychiatric nurses is quite low, in that we've just started, as of May 2020, the board agreed to approve the opening up of representation from all designations. So we have close to 10,000 members, and I believe within our province, we've got about 13,000 members. So we're very pleased with that amount, but we're not satisfied with that amount. We would definitely like to be representing 100% of all designations. And we're very fortunate because, you know, it's broadly across those 5 setting areas, education, research, many of the out of scope positions, where their professional voice or representation is often absent, you know, being not in a unionized position. So that is one of the areas that our members are saying that they feel that the advocacy is assisting them in that area. So yes, we're very happy with that. And I believe the number is attributed to, you know, as I'd mentioned in my presentation, the tremendous support we received from our college when we were established. And, you know, as we're seeing across the country, as more provinces are looking at single mandated organizations, where there's been some challenges in other areas to getting things off the ground. So it's important to do that important work. And I applaud SRNA for the tremendous foundational work that you're doing, because I believe it will put you in a very good position.
Thank you, Mary. Tracy, Mary just spoke to the registered nurses who are working in environments that are potentially not unionized or not represented by the Saskatchewan Union of Nurses. What do you see, sort of as a future state where you might, in terms of collaboration with an association in order to address and provide some collaborative work with individuals who are not necessarily members of the Saskatchewan Union of Nurses?
Oh, we think this is an absolute possibility. I mean, we see ourselves as being advocacy for the profession since 1974. So it is something that we would certainly want to see every registered nurse be part of, whether they're part of the union or not. We certainly are all about collaboration and making sure that we have a very strong, sound registered nursing profession, and that people understand they have the ability to have their work protected. So yes, we would definitely work. We're an organization that's all about collaboration, working with important stakeholders to make sure that the role of the registered nurse is valued and that it is top of mind for public. We, as we all know, I mean, I'm preaching to the choir here, but we all know that we are, pretty close to the most trusted profession that there is. And we take that relationship with the public extremely seriously. It is a sacred relationship, and we do what we can every day to make sure that that is protected, that the public is protected, and that registered nursing is sound and protected. So yes, of course, we would see ourselves as one of the key stakeholders with any association, as we see our relationship with the SRNA being a very key and extremely important relationship. We co-share, over 10,000 registered nurses in this province. So we see ourselves as extremely important, a relationship that is a must. And we would see the same happen to any association that is able to come to fruition in Saskatchewan.
Thank you, Tracy. I will now move to you again, Deanna, and I'm just, in your presentation, you had a slide that was providing us trends in terms of regulation across the country and internationally. And of course, some of the things that you mentioned were trends towards increased public participation on boards, smaller boards, and then multi-professional boards. So a few questions with this is, multi-professional boards and what sort of prompted the development of that particular issue moving in certain parts of the country, BC to name one. And like in Saskatchewan, the Registered Nurses Act actually speaks to council members being elected. And it is very specific in terms of the number of registered nurses. And so we know that there will have to be some changes in the Act in order to sort of move towards these trends. And so can you just speak a little bit about some of these trends and how we can see perhaps operationalizing them here in Saskatchewan?
So just to go through the first point about the increased public representation, there really is I have been looking for evidence to show that councils that have public majorities make better decisions than than councils that don't. And there really is very little research with respect to that, but there is considerable research in the literature that shows that public thinks that panels and councils that have more public members on them than less make better decisions in their interest. So I think that the point there is really about, when you think about public confidence and trust, it's really about that perception of the public, that the public believes that a panel, for example, is more likely to make a decision that is grounded in the public interest, or a council if there are more public members on there. But I did want to say that I didn't want to suggest that there's a lot of research to show that increased public representation makes better decisions, because there isn't. I think the multi-professional boards have been around the longest in the world in the United States, and they're called central agency administrators. And it's not unusual to see 35 or 40 professions being grouped in together under one department of government, because in the States, health professions anyway are very much government regulated. So that's where they've sort of started. I think it was more for economy of scale, economic reasons. And I think that it's the same in Ireland, where they have CORU, which is a multi-professional regulator, and in the UK, where they have HCPC, which is the Health and Care Professions Council, which has 16 different health and care professions council under one umbrella. And I think that was, it wasn't seen as cost efficient or effective to have everyone have their own regulatory body if they didn't have a certain critical mass to be able to support it. So I would suspect that part of that would be a decision that could be made in provinces in Canada, where you have some very small regulators who are struggling to do all those same things that the larger regulators or larger funded regulators are doing. Because as we know, as regulators, you don't get a break because you're small. We all have to meet all of the same regulatory obligations. So I suspect that has something to do with it. And then the other trend is the appointments versus elections. And I think that's just become an internationally recognized best practice, which is that, like any boards, if you're going to serve on boards, you should have some kind of essential competencies or skills to be good board members. And that's maybe the only way you can do that, is to try and, make sure you have some kind of a process.
Okay. And I have another question for you here, Deanna, that's just come in. So Deanna, what is your perspective on the responsibility of the regulator to interact with nursing students, future professionals? Should this be a priority for a nursing regulatory organization?
Well, I mean, that's a good question. I mean, I think that we do have an obligation as a regulator to engage at some level with the students. And I'll just use my pharmacy example. For many years now, the College of Pharmacists has been involved in what they call a white coat ceremony, which happens during the orientation of all new pharmacy undergraduate students. And it's really to let them know what the role of the regulator is, what it means to be a regulated health professional. And other pharmacy groups would be there as well, but it would be to sort of help them understand the differences between the pillars, I guess. The other is that from a jurisprudence standpoint, you want to make sure they understand the laws that they're going to be practicing under. So the college in Ontario of pharmacists is very involved as instructors. We go in as guest lecturers and present some jurisprudence to the undergraduate classes. And then I guess the third thing is we want to talk to the students about the importance of lifelong learning, because as a regulator, that's really one of our pillars, is to make sure not only that people are competent and safe and they have that ability to be competent and safe practitioners at the time we let them in, but that they're maintaining a level of competence throughout the time they're on our register.
Awesome. Thank you very much. And so now I will move back to you, Mary, and just a few comments here from individuals. What do registered nurses in Saskatchewan need to know when forming and creating a new independent association? And what would you pinpoint as the biggest challenge in the transition?
That's a very big question. And I hope that the presentation yesterday and even the opening panel participation that I did will speak to that, because it really did. The opening panel one spoke about the steps that went into being before we even incorporated, which is quite detailed, and getting a business plan and a budget organized, and like, how are you going to operate, all that kind of stuff, a governance model, making sure that there is genuine interest to support this organization. Because if it's a voluntary organization, which I tell you, having never worked in a voluntary organization before, because I've always worked, as nurses, we're usually in our certificate of practice is mandatory. Like if we're in a unionized environment, it's mandatory fees. But when you have a voluntary organization, when you need to make sure that that value proposition is there so that members are interested and will continue to support, otherwise that organization will not sustain. So that's very challenging. It's a challenging environment because, previously when I was working in practice and you had to develop budgets, you basically knew what your revenue was going to be or what your expenses were. But when you're voluntary, you're always making assumptions. Like, if we maintain that membership number, what if it goes down? We also are subject to, I call the unintended impacts of, if our college fees go up or CNPS fees go up, we usually then, because we're impacted by that, because nurses will say, like, you know what, I just can't afford maybe this time to go there. So those are huge challenges to be aware of, and the importance that nurses understand that this organization is for them and by them. Because if they're not engaged with it and embracing the importance, it will be very difficult for it to sustain. Another important lesson learned in establishing is working with the existing professional associations. So many of you would have an existing professional association with nurse practitioners, right? Their professional association or group, as well as specialty groups. Working with them to figure out, because the association is going to be the new kid on the block. So how do we work together so that the common mandates are achieved? So that I think helps strengthen it along the way. Because looking back and reflecting, those are things that was not done to the greatest degree when we first were established, when it was that steering network, but it's certainly been evolving and showing the benefits of that as we've gone along. So I hope that helps, but I'm hoping also the recorded presentation would be a helpful way to look at those others that I identified.
Thank you, Mary. So I have another question here from a member, and it's directed to Deanna, but I'm sure anyone could also comment on this. When looking at the transition to a single protection of the public mandate, what are the activities that must shift from the old body to the association based on current and evolving regulatory literature?
I guess I can take the first crack, but Mary and Tracy, feel free to jump in here. I think the biggest thing is that the question that has to guide the regulatory council, the regulatory committees, regulatory panels really need to be, it would be, is this in the public interest, and how do we know? And I think that is a fundamental difference in maybe how decision making may have been guided in the past. I think if it isn't, we need as regulators to kind of follow some kind of decision framework, and then make sure we stick with it, and it needs to be across the board. The other is that we need to really understand, when we ask that question, how does this impact our profession? How does it impact other stakeholders? And it's not just about nursing, it's about decisions that we make and what are the wider implications of those, because especially we're part of a profession in nursing for sure, where collaborative care, you don't work in silos, you work across the system. So as regulators, we're always very thoughtful too about how our decisions impact others in the system with which our profession interacts and works every day. So I think that may be just a slight shift, but I'll just throw it out as a start and invite Mary and Tracy to weigh in.
Sure, I'll start with just, I know that when the college transferred some of those association functions to us, one of the first things was the Awards of Excellence. So I recognized from attending SRNAs the other night that is their last one. So that I would imagine would be one of the things. So that celebration of nursing excellence and awards for students and things like that. As well, advocacy with government was another area issue. And we all know that advocacy in all of those happens in all organizations. And what I always like to explain when I'm doing presentations is that we have many common priorities, but what happens is that each organization has a different lens or perspective upon which they're looking at that issue and how they address that issue. And that's where the strength can come as well, with that collaboration and talking about where we fit. We often will do presentations jointly with the college and the union to our student groups, are the different 5 programs in the province. Even with meeting with other stakeholders, going together and then being able for those organizations to see how we speak differently to the issue really helps to strengthen the understanding of that. But I would say those are the 2 largest areas. And our college admitted that probably for about 5 to 7 years, they weren't doing association work. So I think members didn't see a big transfer other than the awards. And then when we started doing our services and supports, they could see what an association was doing.
Thank you. And Tracy, do you have anything to add that in regard to what the SRNA should probably stop doing right away as we move towards that single mandate of regulation?
Not sure it's really in my wheelhouse to talk about that kind of role. I think the most important thing is that we all understand that we need to work together. I think it's all to something that we all need to take responsibility for, is making sure the public clearly understands what each of us do, where we overlap, where we complement one another, and what our roles are. Because I think it's important that they know once the association is developed what its role is, doesn't get it confused again with what the SRNA is doing or what the Saskatchewan Union of Nurses does. So I think that it will be incumbent upon us to make sure that people understand where we intersect and what our roles clearly are. So I think it's communication, making sure that all of this is well communicated. The public and our shared membership understands what it's going to mean to them. I mean, SUN, as I stated in my presentation, we do not have anything to do with the regulation, with the legislation, with deciding all of those things. So that is something that the SRNA is going to have to decide what they do best and what they do next. As a working registered nurse in this province and a member of the SRNA, of course, I'm hoping for clear communication from the SRNA as to what's going on and to be able to have conversation when it's required.
Thank you. Mary, we're just going to have you share now. Yesterday during your presentation, you ran a poll and you asked participants some questions, and we would hope that you can briefly give us some highlights of these poll results.
So I'll just go briefly. It was interesting for me to see that 40% of the attendees had 31 to 40 years of practice. So it was really nice to see that engagement. And then each other years of practice category had about 15%. So it was a really nice cross section. And so for the understanding my question about the association's mandate, everyone chose professional voice in promoting nursing excellence, which was great. 95 said advocacy for the profession. And then there was 14% and 5% that had relation to, chose an item related to the college's mandate. So that's very typical. Like even now when I'm doing presentations, I ask that question and there's still not confusion, but again, I think it relates to the overlap because we talk about advocating for healthy public policy and that the public that we serve. So I can understand why people think we are referring to the public interest, but really public interest and to serve and protect public interest is the primary mandate of the college. So it's always a nice opportunity to reiterate that. I really was interested in your advocacy issues that you identified, and really nice to see 82% related to Indigenous health. So really it mirrored very much what our recent survey of our members do. We do an annual, quite a large annual survey every year, asking our members, because we are our members, right? We're there for members. What are their advocacy issues that they feel are most important across all practice settings? And very, very much of interest. You had identified Indigenous health higher than in Manitoba. And I applaud you for that because we have very similar issues with that group having the poorest health outcomes in our province. So we are certainly working on that. Harm reduction, you can see, those areas are key, especially with COVID, right? We're seeing a lot of the impacts there. Social determinants of health, the health promotion, the importance of, our model of care and nursing is upstream work. That's where we really want to push things, get the public aware of. We're never going to be able to support the dollars amount needed in our acute care system unless we get people well as much as they can. So
well,
very interesting.
I'm sorry to interrupt, Mary, but we're running short of time.
Okay, I'll just show those there for people to look at while you.
And we will be posting the results of these polls on our Voices in Action Facebook group. So if you want to see those results, you can go there and join the group if you haven't done so already. I'd like to thank you all, Tracy, Mary, and Deanna, for joining us this week to share your stories from each pillar's perspective and for this insightful Q&A conversation. It's always a pleasure to hear a range of perspectives in order to garner a clearer picture of the whole situation. Next week, we'll be asking our attendees to take the information they heard this week and put their voices into action. During our 4 Voices in Action virtual revolving conversations, participants will have an opportunity to contribute towards the next steps in creating an independent association. This year's revolving conversations will be led by nurse leader champions who will help to facilitate discussions focused on the creation of an independent association. The first session on Monday will focus on the governance structure that would support a successful association for registered nursing in Saskatchewan, and we encourage you to tune in on Monday at 12 p.m. to participate. A reminder that the recorded version of this session will be available for 30 days to rewatch at your leisure, and we invite you to email any additional questions or comments to conference2020@srna.org and join our Voices in Action Facebook group to continue the conversation. We thank you again for joining us today, and we'll see you next week. Have a great day and stay safe.
Thank you.